world of immediate gratification. We want something to be exactly when we want it right now. We don't have to wait for it. We want everything to happen quickly. We don't want to have anything happen slowly. And that also goes for the healing process. So anytime anybody wants something, they want it now. So if you get sick, you don't have time to be sick. And I get that. You don't have time to be sick. So you immediately want to go to the doctor and get it over with and get healed and get done. And so most people, when they get a cold even, or a sinus infection, they will go to the doctor and they will have him give them a steroid shot. And I'm going to talk with you today about what steroid shots do, how they work, and some of the side effects of steroid shots, and why you need to be very, very careful about when you decide you're going to get a steroid shot, and if you need to get that steroid shot the next time you get sick. So, the first thing, and I try to always get my sources from, I try to get them from legitimate places. So my very first source is actually from mayoclinic.com, or excuse me, .org. And I'm going to also provide the sources down below. So if you're interested in finding out more information about it, you can click on that too. So the first one's from Mayo. And the Mayo Clinic says, according to them, corticosteroid drugs, including cortisone, hydrocortisone, and prednisone, are useful in treating many conditions, such as rashes, lupus, and asthma. But these drugs also carry a risk of side effects. So they say that right there. They know that there are side effects. How do they work? Corticosteroids mimic the effects of hormones your body produces naturally in your adrenal glands, which are small glands that sit on top of your kidneys. When prescribed in doses that exceed your body's usual levels, corticosteroids suppress inflammation. Corticosteroids also suppress your immune system, which can help control conditions in which your immune system mistakenly attacks its own tissues. So, the whole purpose of a steroid is to shut down your immune system. Now, if you're having a terrible allergic reaction and you are in bad shape and maybe you're having anaphylactic shock, something like that, you have to have something serious to stop that. I get that there can be possible reasons for steroids, but they are overused and they're being used to the point of really it's getting where it's abused. And it's hurting our bodies. So when you're using this, you're getting immediate relief. Because as it said, it is cutting down on your symptoms. You don't have your symptoms anymore. So you leave the doctor and you feel great. You go home and you clean your house and you feel awesome. But what you've done is you've suppressed your immune system. Well, guess what that does? Especially in the wintertime. You have now opened your body up to receive more harmful things, more sicknesses. So anything that's out there, your body is now going to latch onto that easily. So you get into a loop. And this is what happens. You go to the doctor for a sinus infection. Okay? You get a steroid shot. You feel great. You get out, you do everything that you normally would not do if you were sick. Normally, if you were sick, you would stay home while you have that lowered immune system. But you feel good. So you get out and you do things that you normally wouldn't do because, hey, we don't have time to be sick, right? We got to keep going. So you get out and you go and you pick up all these other germs. You get sick again. Only this time, your immunity is lower, so your sickness is worse. So guess what you have to do? You have to go back to the doctor, get another steroid shot, and guess what you've created? A loop. And we have a whole society of people that are chronically ill because you have set up this loop, this cycle, where you will constantly have to go every 3, 4, 5 months and get your steroid shot to keep yourself going. And what you're doing is you are suppressing your immune system continually. You are just making your body weaker and more likely to get sick more often. Now, I have never ever even had a steroid shot. But then again, I don't really go to the doctor very often either. So I am a very holistic type person. I do as much natural as I possibly can. And if I get sick, I have been sick for a very long time before where everybody said, come on, you have got to go to the doctor. You obviously have a sinus infection. I'm like, yeah, I know I have a sinus infection, but I'm doing everything I can do to work with it naturally, and eventually it'll get better. And yeah, it took like a month. I'm saying it took a while, and I felt pretty awful for about a month. But it was worth it to me because my body was able to get stronger instead of weaker through fighting off that infection. So it's important that we let our bodies do what they're supposed to do and not suppress them from that. Now, that being said, I do realize, I'm not a doctor, and I do realize that there are times when we have serious issues, that there's a time and a place for certain things. But we don't need to overuse some of these things that we're using. With steroids too, I'm going to go into some of the side effects. And this is also on mayoclinic.org. Because oral corticosteroids affect your entire body instead of just a particular area, this route of administration is the most likely to cause significant side effects. Side effects depend on the dose of the medication that you receive, and it may include elevated pressure in eyes, glaucoma, fluid retention causing swelling in your lower legs, high blood pressure, problems with mood swings, memory, behavior, and other psychological effects such as confusion or delirium, weight gain, which, I mean, anybody that's been on steroids will tell you that one, fat deposits in your abdomen, face, and back of your neck. When taking oral corticosteroids on a long-term basis, you may experience clouding of the lens in one or both eyes, cataracts. And you see a lot of people with cataracts walking around. High blood sugar, which can trigger or worsen diabetes. So it's causing diabetes. Increased risk of infections because you've lowered your immune system, especially in common bacterial, viral, and fungal microorganisms. Thinning bones, osteoporosis, and fractures. We know a lot of people falling and getting hurt, and a lot of people with osteoporosis. You didn't see that. You didn't used to see that. Thin skin, bruising, and slower wound healing. So, and then you have inhaled corticosteroids, fungal infection in the mouth, and hoarseness. And there's just a whole lot of different issues that come up. So, do the benefits outweigh the risks? You know, you really want to make sure that you're not doing this often because this can really affect your health. Yes, short term you feel better, but long term, what is this going to do to you? So your sinus infection is gone and you feel great, but in 30 years, this is going to affect your bones. This is going to affect when you fall, whether you break that hip bone or not. You know, do you want to break that hip bone or do you want to be in really good health and you fall and you bounce right back up? And this is a really huge issue. Trying to see what else we got. It's also good for antihistamines, decongestants, for allergies. But the side effects for using it for doing it for allergies would be anxiety and restlessness, insomnia, easy bruising and thinning skin, facial swelling and redness, hypertension, that's high blood pressure, high blood sugar, increased appetite and weight gain, low potassium, mood swings and behavior changes, salt and fluid retention, stomach upset, weakness and near the injection site. All right, here's some long-term effects, which we've already done some of these, but vascular necrosis, I'm not even sure what that is, osteoporosis and fractures, cataracts, Cushing's syndrome, diabetes, glaucoma, increased risk of heart disease, herpes keratitis, hormonal suppression, obesity, peptic ulcers, psychological symptoms such as depression and psychosis because you had a steroid shot, severe hypertension, tuberculosis, and chronic infection. Verywellhealth.com talks about the steroids and again a lot of the different types of side effects. All right, so short-term versus long-term therapy. What is the difference? Okay, in short-term, prednisone is usually prescribed at moderate dose and reduced to taper off over a 1 to 2 week period. The purpose is to achieve a sudden improvement in symptoms, but not to prolong the duration of the corticosteroid use. Long-term therapy is usually reserved for severe cases of rheumatoid arthritis or related diseases. The dose is usually 5 to 7.5 milligrams of prednisone a day. Of course, y'all probably know all of this. And you must reduce it gradually or it can cause serious issues. Another complication associated with discontinuation of steroids is withdrawal syndrome or a rebound effect, which is the body's exaggerated response to removal of the drug. A rebound effect can result in fever, muscle pain, and joint pain, making it hard for the physician to differentiate between the withdrawal symptoms and a flare-up of the disease itself. So that's also an issue. All right, and we're going to go into what effect do steroids have on your bones, okay? So steroid medications have major effects on the metabolism of calcium, vitamin D, and bone. This can lead to bone loss, osteoporosis, and broken bones. When steroid medications are used in high doses, bone loss can happen rapidly. It is important to know that not all people who take steroid medications lose their bone mass, but there are different rates of bone loss among individuals taking steroid medications. The exact reasons for these differences are not known, but probably include differences in steroid dose, the effect of certain underlying diseases on bone loss, and perhaps some people are genetically more susceptible to the effects of steroid medications. For example, postmenopausal women who take steroid medications for longer than 6 months have a greater risk of bone loss. So the older you get, especially if you're a woman, the worse this is. This is the more important it gets that you do not use steroids if at all possible. Bone loss occurs most rapidly in the first 6 months after taking oral steroid medication. After 12 months of chronic steroid use, there is a slower loss of bone. Some people are concerned about the inhaled steroids. Inhaled steroids are less likely to cause bone loss than steroids taken by mouth. However, in higher doses, inhaled steroids may also cause bone loss. Steroid medication used for days or applied to the skin are not associated with bone loss. Major impact of steroid medications on bone is fractures, broken bones, and the most occur commonly in the spine and ribs, which is surprising. I figured it'd be hips. Steroid medications taken by mouth equal to or more than 5 milligrams of prednisone daily, taken for more than 3 months, is considered a risk for fracture. So if you're on steroids for 3 months, then you are at high risk for a fracture. Almost 1 in 3 postmenopausal women who routinely take steroid medications will have a spine fracture. A person on steroids is more than twice as likely to have a spine fracture compared to a person not taking steroids. And this is just kind of scary. And that fact that so many people are using these steroids on a monthly basis, or however, wintertime is coming up. So I know during the summer you don't have it as much, but during the wintertime it's happening constantly. I even read, I don't think I put that in there, but I read somewhere when I was doing some of my research that doctors usually try to look and see how often you've had one. They try to not give it to you very often, and they try to keep you to having 3 a year. So you need to think about that and think about how many times you've been sick and how many times you've had a steroid shot, and decide whether or not you've had it more than 3 times that year, because if you have, you're getting into a danger area. You need to make sure that you are keeping it, if at all possible, non-existent, because it's not doing any good to your body. It's suppressing your hormones, it's suppressing your immune system, and it's not letting your body heal. We have to trust our bodies. I know God made us in a way that our bodies are amazing. And we are able to perform where we don't give our bodies credit, because He's designed this, and He knew what He was doing. And even things that now we're finding out that getting the measles can actually reduce your risk of cancer later on. And yeah, the measles may be bad, but if you get the measles, then you cannot get cancer. That sounds awesome to me. There are some major things that our bodies do. We don't really understand the reason why, but if we start doing some research on it, it's like, oh wow, our bodies are amazing. The way they work is just amazing. So when next time you think about going to the doctor and he offers you that steroid shot, he or she offers you that steroid shot, think about it first. I cannot tell you the times I have been offered steroid shots, and I always say no, and I have to wait longer to get better, and that's just, it's the price you pay. But it makes you healthier and happier in the long run. And I'm really hoping that will keep me from losing bone loss later on. Also, when you're younger, for any of you that are younger, I'm not anymore, but for those of you that are younger, if you are watching this and you're trying to think of some ways to prevent that bone loss, and you're trying to think of ways to be healthier, and hey, even us older people too, one of the really good things about strength training is building up that muscle and that bone. And as you're doing strength training and you're doing weightlifting and all of that, you're actually building your bone mass. So if you're younger and you go ahead and you start building that bone mass up, that helps you when you get older to not lose that. And of course, as you get older, you can still, try to pump that iron and get that bone mass up, but you've already lost some of that bone mass, because as we get older, we get shorter and we get fatter and our bones get smaller. So we want to make sure that we keep healthy bones, and part of that is getting that weight training in, that exercising in, and keeping those bones strong and healthy. And you do not want to to get those steroid shots and make that worse. So that's all I have to say today about that. Just think about that steroid shot next time you go to the doctor. Try to make a really good decision about how bad you really feel and if you really need it. And try to go as long as you possibly can. And start looking up some natural ways to boost your immune system and to help your body overcome that. Vitamin A, vitamin C, elderberry. There are a lot of basic things that are very easily accessible in our world that you can do to help your body and your immune system and not have to get those steroid shots. So I will talk to y'all later.